Good day. I'd like to talk about how healthcare is organized. When eventually we do need the input of a health practitioner, where do we go to? Where do we start from? Healthcare needs to be organized so that it benefits all of us. It's one area of life where all of us need to contribute to a working healthcare system. And it's easy to illustrate this. Imagine what happens when one person catches a cold. If precautions are not taken, could easily spread to others. Same with other communicable conditions. For instance, a reckless person who contracts an STI could easily just transmit that sexually transmitted infections to others if he doesn't actually take precautions to prevent the spread. So you can see that a problem affecting one could easily affect all. The other thing to note is that the health system is actually organized in levels. You've got the primary level, the secondary level, the tertiary level, and the quaternary level. It just goes from the most basic part of the system. So at the primary level is usually the first place that we go to for help. It's manned by general practitioners or family physicians, maybe internal physicians, pediatricians. All these doctors are at the primary level. And then as you go higher, you get into the secondary level. A good example of secondary level of care is like a general hospital in Nigeria. And then you have the tertiary level where you have the teaching hospitals. And of course, sometimes you also have the quaternary levels. These are the research institutes that are set up for specific conditions. So usually at the start, when we're well, typically we would engage with the primary level of care. So ideally, everyone should have a family physician that he goes to help organize those activities to help us stay well, like advice on nutrition, advice on exercise, advice on sleep, immunizations, and all those things we talked about in the previous discuss. But something that is important is that as we go through life, it is very likely that sometimes we may get unwell, and that will see us moving from one level to the other. So it all depends on the nature of the illness we have. Sometimes it may be that our care will then move from the primary level where the basic things are done to a secondary level, following a referral. And of course, it could also go to the tertiary level. And one thing to note is that, yes, this care can move from the primary level all the way up to the quaternary level. But as things improve, it should also scale back down to the primary level again. So most times, in terms of that continuous engagement that continues in life, it should actually sit at that primary level in the hands of a very caring family physician. Thank you. My name is Dr. Elvis. I'm a specialist general practitioner. My practice straddles Australia and Nigeria. Thank you.